Okay, so it is 1 o'clock and I'm going to go ahead and get started. My name is Kristen Fleming, for those of you who don't know me, and I am the Education and Training Coordinator for the Alzheimer's Disease Caregiver Support Initiative. I'm here in our Plattsburgh office today, but we actually cover 6 counties. They are Clinton, Franklin, Essex, Warren, Washington, and Hamilton. And I am the regional coordinator for all of those counties. We have a grant from the New York State Department of Health to provide services for caregivers of people with any form of memory loss, including Alzheimer's and other forms of dementia as well. And we do that through 6 different service areas. So first one is education and training. That's what you all came here today for. During the COVID-19 pandemic, we are offering all of our education virtually. So I'm doing a whole webinar series. And then I'm also doing individual education sessions. So you can sign up to meet with me one-on-one over Zoom or over the telephone, and we can talk about different topics that are related to your specific situation. Today, I'm talking about planning for future care. We also offer individual care consultations with our care navigator. So for each county, we have a care navigator who specializes in meeting with caregivers and talking about your specific situation, helping you address any of your concerns, referring you to different aspects of our program, but then also other community programs as well. We offer support groups. And again, right now, those are all happening either over the telephone or on Zoom. And the nice thing about doing them virtually is that you can tune in to whatever day or time works better for you. You're not stuck going to the one that's for your area. So we're still offering 7 throughout each month. And that way, if the evenings work better for you, you can call into the Clinton County one. The mornings work better for you, maybe you call into the Hamilton County one. It's really up to you. We also offer memory cafes, and those are virtual events. Right now, for December, we have a snowman ornament craft that we're going to be doing. So you register to participate in that memory cafe. I will coordinate with the care navigator in your area to deliver all of the supplies you need, and then you would get on Zoom on the specified day and time to do this snowman craft. We're also offering music events as well. So there's a musical performance that is happening on Zoom once a month. Let me think. So we covered, I have 2 more service areas I want to cover. So one is going to be our respite program. So that's a limited part of our program, but if you are the primary caregiver, we will actually pay for someone to come into your home so you can get a little bit of a break from caregiving. It's not meant to be to replace you as a full-time caregiver. You also can use those respite hours at adult day programs. So it's really up to you. If you have a friend or a family member that you would feel more comfortable being your respite provider, we can sign them up with our program too. So it's really flexible. But again, it's a limited number of hours. And the last thing I want to mention is Project Lifesaver, which is a bracelet that your loved one would wear on their wrist, because a lot of times people with dementia will wander. So even the most vigilant caregivers, they can't supervise their loved one 24/7. You know, you have to go to the bathroom sometimes, you have to sleep at night, you have to take a shower. So what do you do if you wake up in the middle of the night and your loved one's not there and you can't find them, and maybe it's cold out and they're walking around with no shoes? We partner with the sheriff's department in each county, and you would call them and they would help you locate your loved one. They have a big wand that they use to find them. So those are most of the, if not all of the services that we offer with our program. And I just want to go over a couple of housekeeping notes too before we get started with our presentation. One thing I want everyone to know is there is a question and answer box, and you are more than welcome to type in questions throughout the presentation today as you think of them, because I cannot see and I cannot hear you, but I am happy to answer any of your questions that you may have. And with that being said, we're going to start talking about planning for future care. All right. So I want to start the conversation. This is often a difficult conversation for people to have. And so these are some statistics and some things to think about when you're starting to think about the future. You're not alone today. More than actually, I think this might be a little bit of an old statistic. I think it's from 2017 or 2018. But today, 67 million Americans are providing care for a loved one. Now, this could be for a parent, for a spouse, for a child, an adult child with disabilities. There's different situations for everyone. But that number is actually expected to grow as our population ages, especially with the baby boomer generation. So it's important to start talking to your family about what aging with dignity means to you. We all want to have a say in how we age and what we want our future to look like. So have that conversation early on, especially when we're talking about dementia, because in the future, you may not be able to share what your wishes are. Different people need different kinds of support. So as people age, they tend to need help with some things that we might take for granted, things like showering or preparing meals. So think about different types of support you might need. Family members are often the backbone in caregiving. Usually family members will help out in 3 different ways. They'll either provide hands-on care, financial support, or emotional support. And all of these things can help family members stay in their homes longer. Long-term care is very expensive. In 2011, so this is definitely an old statistic, I'm sure the price has gone up. The average cost of a semi-private nursing home bed was $78,000 a year. $78,000 a year, that's expensive. It's more than college tuition. And the average cost of a part-time aide in the home, this was a little more affordable, it was $22,000, but that's still a lot of money, and most people cannot afford that. Medicare will not pay. It will only pay for short-term nursing rehab stays. Talk to your loved one. I already said this, but I just cannot emphasize this enough. Talk to your loved one. Don't wait for an emergency to happen to start talking about the care that your loved one may need. And keep in mind your loved one's wishes. You can talk to their doctor as well to find out how their needs have changed and how they might change in the future. And creating a strong care team of people will help. Find out who your loved one's healthcare proxy is. Learn who's been designated to make important medical and financial decisions. That's very important to know. And I just want to emphasize this again too. We all want to age with dignity, choice, and independence. So talk to your loved one and find out what that means to them and what gives them the feeling of having a full life. So now that you're starting to think about the future a little bit, you want to plan ahead for doctor's visits, regular checkups. Make a list of any questions or concerns you may have. If it makes sense, especially depending on the stage that your loved one's at, you can include them in that conversation as well. Ask them how you can be helpful during the visit. Do they want you to answer questions, or do they want to try to answer questions? Are there other caregivers? Like, let's say you have siblings and you're all caring for your family, your mother or father together. What are their concerns? You want to include them in that conversation as well. You want to bring a list of all of the medications you're currently taking, including over-the-counter meds. Make sure you include the dosage as well. And how often they're taken. This is especially important if your loved one sees more than one doctor and maybe a specialist has prescribed something new. If possible, have the person that has dementia or the memory loss answer the questions that the doctor asks and have the conversation with the doctor to the best of their ability. And respect their privacy. If they ask you to leave the room, give them that dignity. If you live out of town and you're a long distance caregiver, talk to the doctor about how you can stay up to date on your loved one's health, and ask about community resources. A lot of times doctors' offices are aware of other programs, or they maybe have a social worker on their staff who can help point you in the right direction. So when talking about planning for the hospital, there are two different situations. It might be an emergency visit to the hospital, or it might be a planned visit to the hospital. So we're going to start by talking about an emergency visit. For a person with dementia, it can be even more scary to go to the hospital than it would be for someone like you or I without any memory loss. And so here are some tips to help make it a little bit less stressful. Possible, bring an extra family member or friend so that someone can stay with your loved one at all times. And that way, when you're talking to the doctors, they're not left alone. Be ready to answer lots of questions from the hospital staff in regards to what led your loved one to coming into the hospital. You might have to answer these questions more than once, which can be really annoying. Talk to the staff, let them know that your loved one has dementia. A lot of times, this surprised me when I first started working with people with dementia, but a lot of times the emergency room staff do not have a lot of experience working with people with dementia or with memory loss. So they might not understand why why they're acting the way they are, or why they can't answer questions. So you might have to help them understand your loved one. Comfort your loved one, try to stay as calm as possible, and that will help keep your loved one calm as well. And be patient. Depending on how busy the emergency room is, your wait time might be quite long, but just because you don't see the staff working doesn't mean they're not doing stuff in the background. And do not leave the emergency room without a plan. If your loved one is not admitted overnight, make sure you understand all of the follow-up care instructions. And if your loved one does stay overnight, try to have someone stay with him or her. It can be a good idea to have a bag packed all ready to go for in case of emergencies. That way you can just grab it and go out the door with it. So in that bag, you would want to include health insurance cards, list of medications and medical conditions, a list of doctors, healthcare advance directives, snacks and bottles of water for yourself, depends if they're worn, any comfort object. This could be a soft blanket or favorite sweater, a change of clothes, toiletries, and medications for yourself. Again, pain medications for yourself. I would hate to have a headache in the emergency room and not have any Tylenol. I think that would be like one of my worst nightmares. Some paper and pen, and some cash, just in case. You never know what you might need. And before a planned stay, you want to have a conversation with your doctor to make a plan and make things go as smoothly as possible. So first of all, think about if hospitalization is even the right step. Speak with your physician. Is this something that could be done outpatient, or is it appropriate for your loved one? Have a care team to help you through. Don't try to do the whole process on yourself. It will be really helpful to have other people involved. Know what kind of anesthesia would be used. General anesthesia a lot of times can have side effects, so it might be better to use a local anesthesia if possible. You also want to make sure that their regular medications will be continued, and find out if it's possible for you to get a private room. Will your insurance company cover that? Because a private room will be much more calm, less confusing for the person with dementia. Involve your loved one in the planning process as much as possible. So do not talk about the hospital stay in front of them as if they're not even in the room. That can be really upsetting for them. And shortly before you're leaving your home, tell your loved one that they will be spending a short time in the hospital. During the stay, you want to, again, talk to your doctors and let them know what the best way to approach your loved one is. Ask them to limit questions for the person with dementia. Help the hospital staff understand why they might not understand, or why they might not remember things that happened 5 minutes ago. Make sure someone stays with your loved one, especially because this can be a very confusing and stressful time for both the primary caregiver and for the person with dementia. And your loved one is going to need help with a lot of different things. They might need help using the bathroom or filling out meal requests. They might forget to drink water. They'll probably have difficulty finding the call button in the bathroom and the adjustments because they're in an unfamiliar place. Communicate so they will understand. Make sure you slow down. Try not to rush them. You want to make sure someone's advocating for your loved one too. Talk to the doctors and the staff immediately if the person seems worse or different. Maybe have somebody else be in charge of having friends and family members updated, so you're not the one who's talking to the doctors and having to call everyone. It might be more confusing for your loved one, and take breaks. It's okay if you need a break to go for a walk, to get a drink of water, whatever it is, and then come back. We all sometimes need to get away. All right, so that's it for the hospital stays. Like I said, if you have any questions throughout the presentation, feel free to type them into the chat box. And now we're going to switch gears a little bit and talk about getting outside help. So in most caregiving situations, friends and family members are the first ones turned to and asked for help. If a caregiver feels like they have the support of other people, they can manage the burden of caregiving a lot better. People usually want to help, but sometimes they don't know how or what would be helpful to do. So you simply need to be the one to ask for help. In some cases, it might be family dynamics as to why people don't offer to help or why a caregiver will hesitate to ask for help. And I have a whole presentation on family dynamics. If that's something that you're struggling with, feel free to reach out to me after. I do have a recording of it, or I'd be happy to do it one-on-one with you. In a lot of cases, family members or people in general are simply just not comfortable around a person with dementia. Maybe they've never worked with someone who has memory loss before. They don't know how to act around them. They don't know what to expect. They don't know how to talk to the person. So help them by explaining why the person acts the way that he does. Also remind them that dementia doesn't only affect a person's memory, but several other pieces of the person as well, like their language. Some community members might be able to look in on your loved one. Neighbors or the mail person might be able to check on them during the day. The pharmacist can help you with keeping track of prescriptions. As you think of people to help you, try to think outside your close network of people too. Remember that no one is going to do things the same way that you do. It's important to thank that person for their help and don't criticize their work or their help, or they won't be likely to do it again. So there's a question. No one is allowed with patients at this time unless end of life due to COVID. So suggestions for that, yes, because that is a very real problem right now. And I think you're referring to hospital stays. Am I correct? I'll answer it like you're referring to hospital stays. So that is really challenging. You want to make sure you are communicating with the staff. Let them know that your loved one has dementia, what their needs are, what some of their typical, yes, in reference to hospital stays. Yeah, so communicate. You want to be calling the doctor or the staff and letting them know what your loved one's needs are, what you still have to advocate for them, even though you're not there. So that can be really challenging too, to make sure that they're getting their needs met. And also see, I don't know nursing homes are doing this. If you can do virtual FaceTime visits, if they have iPads, they can help your loved one use, so you can have a conversation with them and see how they're doing. I think in some hospitals too, they also have like cameras that they can have in the room, and that way you can pop in and see how your loved one's doing. I hope that helps give you some ideas. Now let's go into home services. So a lot of times Caregivers will get to a point where they need some help from outside of their network of friends and family. So having a homemaker come into the house to just help you with some household chores, things like laundry, cooking, grocery shopping, picking up the prescriptions, that's one option. Could also hire a home health aide, and that would be a person who could help the person with dementia with bathing, eating, dressing, going to the bathroom. A sitter or a paid companion could be a person who just sits with the person with dementia. Maybe they help with light housework or meals. Some sitters might also be comfortable with doing bathing. You'd have to check with them. But they also, one of the keys is they can help with socializing and helping your loved one do activities. Keep them busy during the day. Visiting nurses can sometimes be sent out by health agencies, and they watch for a change in the status of the person. They'll also help with changing catheters or giving shots, but it can be expensive to have the nurse to come into the home, and Medicare will only pay for it under strict guidelines. Most families will turn to home care first, and it can be good for people who are unable to get out of the home due to illness. While it provides supervision and personal care, it does not provide much socialization and activities as some of the other options. Adult day programs, this is another option. So these offer a day of structured recreation for the person with dementia. Some programs may be for people with dementia only, or some might just be for elderly people with physical impairments as well. Adult day programs can be a very important resource for families. It can be beneficial for both the caregiver and the person with dementia. And attending an adult day program can give the caregiver and the person with dementia the feeling, a break from each other. They can both benefit from spending time with friends and participating in activities that they are interested in. A person with dementia might be reminded of their shortcomings at home every day. However, he can still enjoy music, laugh, talk with friends, do simple activities. You can make new friends in the program too. A lot of the time, staff will report that your loved one has regained his sense of humor or seems more relaxed and seems to enjoy the activities. One thing that seems to hold families back from attending adult day programs is transportation. It can be a barrier for families to find a way for them to get there. And this can be time consuming and expensive. So some programs are able to provide transportation themselves, while others will contract it out. Either way, ensure that your loved one is going to get the proper supervision that they need in the drive in. And in a lot of situations, families will look to adult day programs as a last resort, but can actually be beneficial to start attending sooner rather than later. This allows the person to adjust to the program and enjoy some other parts of the program, some of the activities and making friends while they're still able to. It also gives the caregiver a break earlier and prevents them from getting burnt out. And I will say that right now, I believe a lot of adult day programs are actually open to following new guidelines. I believe they might have a shorter or a smaller group. They have to be wearing masks. They have to be able to keep the masks on, but and other with reminders. And I'm sure there are other new procedures, but they are actually opening up. Excuse me. Short stay residential care is another option, and this is something that people often are unfamiliar with, but it's when the person with dementia will go into a nursing home for a week or two, and this is usually time used by the caregiver to have a break, go on vacation, or to receive medical care. Caregivers are usually very excited about this option once they give it a try. So, for example, I was working with a woman who needed a surgery. And so it was just a a small minor procedure. She was caring for her husband, so he went into a short stay residential care program at it was actually at Plattsburgh Nursing and Rehab, just for a couple of days, so she could get the surgery she needed, and he could get the care that he needed. And she actually really was very impressed with the service, and he actually enjoyed his time there as well. So that's a great option if you do need a vacation or you need some sort of medical treatment, something like that. Because changing a person with dementia's environment can be confusing for them, though, make sure you you pick a place that has experience working with people with dementia. And if it is a home, make sure they have staff available to help if he becomes confused, so they can give him individualized attention. So someone in the chat box is asking, yes, Third Age is open. I do not know what their hours are off the top of my head, but you could contact them, and I can pull up their phone number right now for you and see what they have. But I do believe it is open now. Bear with me one moment. So their hours, it has it on here. Their hours are 8 to 4, 4:30, it says on their website. And their phone number is 518-564-2329. And I'm going to put their phone number in the chat box here so that you have it in case you didn't have a pen and paper. 518-564-2329. There you go. All right. So what to do if the person with dementia rejects care? They say, no way, I'm not going to Third Age, or no way am I having a babysitter come into my house. I'm an adult. I don't need someone watching me. I'm not a baby. There's a few different options. So I think for me, the biggest thing is how you approach it. So there's going to be a big difference between, so-and-so is going to come babysit you versus, so-and-so is going to come over and have lunch with you while I run to the store. That they might be met with a different approach. Or, I've hired this new house cleaner. She's going to come by while I go out for my doctor's appointment or get my hair done or whatever it is. And then when she's there, okay, well, she's doing a little more than cleaning the house. Maybe she's cooking them lunch or spending time with them. You can also hire a friend or family member, someone you're already comfortable with, to be your respite provider. So that's something else important to keep in mind. A lot of times there is a period of adjustment, so it can be hard to remember this as you're often exhausted and ready for the break yourselves. But allow for a good trial run, and oftentimes your loved one will eventually start to accept the help. If you're talking about a day program, remember that each day that your loved one goes to the day program is like starting over for them. They might not remember what happened yesterday or the day before. Usually the routine of it does start to catch on over time, but keep the visits either to the day program or with having the caregiver come over consistent to allow for a routine to fall into place. Eventually they will get more comfortable with it. And when your loved one comes home, they might tell you that they were hit during the day, or they weren't able to eat anything. They were starving. So talk to the program staff about what was brought up to you. However, remember that people with dementia often misunderstand or don't remember what happened correctly. So it could be that they don't remember having lunch, or if they were hit, maybe the staff dealt with it appropriately, but they didn't remember that. So talk to the staff. It's important to ask your loved one how their day was and check in with them and investigate anything that they tell you, because you do want to make sure that they're being safe and they're being taken care of. But at the same time, talk to the staff. Try to get both sides of the story. See, there's another question. So third age, Dave, I don't believe is, well, I don't know if you have to be a Clinton County. That's a good question. I don't know if you have to be a Clinton County resident. I know they probably don't do transportation to other counties or other areas, but if you were willing to drive your loved one there, I'm not sure if you're able to or not. That would be a question for them. And I'd be happy to investigate that and find that out for you. All right, so how to help your loved one adjust. Make the first few visits short. Try to stay with them the first couple times too, or even see if you're doing a day program, if someone could visit from the program your loved one at home before the first time they go there. Just try to help ease them into the new program. Okay, so now we're talking about long-term care. There's no right time for placement. I think that's one of the trickiest things. In most situations, it just gets to a point where your loved ones can no longer get the care that they need in the home for whatever reason. And for some families, the caregiver is worn out, and others, the life demands make it difficult for full-time caregivers. Just maybe they have family of their own or work. But at the end of the day, it tends to be that for some reason the loved ones cannot provide the care that you need in the home anymore. Many families will try several different options for placement, as it can be a very difficult decision to make. However, it's often the most responsible decision you can make if the person needs care that you can't provide for them anymore in the home. It can be helpful to talk to your loved one early on about these decisions. Knowing a person's feelings on residential and nursing homes can help make the decision a lot easier. And a lot of times families will feel guilty for placing their loved one in the nursing home. However, they could also be relieved. And then maybe they feel guilty that they feel relieved. You know, it's a cycle. Maybe they're relieved for the fact that the decision's made, so weight off their shoulders. At the same time, they can feel guilty for wanting somebody else to do the care. So it's very common to have those mixed feelings over the placement. Some things to think about, questions to ask yourself and your care team before you decide on placement. Why is it best for the person to move? What is the cost of care in a nursing home or residential home that we're looking at? How are we going to pay for it? What are the advantages and the disadvantages to the facility that you've chosen? And what changes will happen because of the placement? So there's a few different types of facilities. So assisted living facilities will provide people with help for daily tasks, but they don't provide any nursing or medical care. So that people need to be able to walk on their own, participate in their own care. One appeal to this type of facility is that it feels like more homey and less like a hospital, the way sometimes nursing homes will feel. The assisted living home also tend to be a little bit less expensive, but there's no financial help from places like Medicaid. A person could be discharged if she or he is no longer able to walk, or if they need any more care than like nursing or medical care that the facility is not able to provide, or maybe they're having some behaviors that they cannot accommodate in the assisted living facility. Continuing care communities. So these have a range of services that start from independent living all the way to long-term care. Usually as part of the basic package, a certain number of meals are provided per month. As the person declines, he moves to a different part of the community to meet the level of care that he needs. And in order to live in a community like this, people can expect to pay a monthly fee in addition to an initial down payment or entrance fee. The independent living area could be set up as condos where the resident would pay for a monthly mortgage as well as the monthly condo fee to help with maintenance and buildings on the buildings and grounds. Some facilities will allow spouses to move in together. However, not all will accept a person with dementia, or they might charge a higher initial down payment. And when a person or a couple is accepted, the facility may provide care until they pass away, even if they run out of money. Before a person commits to a community like this, they should do research and read all of the contracts. Once you've put your resources into a program, there isn't much you can do to change it. And the continuing care communities located closest to us are in Rochester, in Ithaca, and Shelburne, Vermont. This is according to the Commission of Rehabilitation Facilities and the Continuing Care Accreditation Commission. However, there could be other communities in our area that are not part of this group and that I'm not aware of. Nursing homes, these are what everyone is the most familiar with when it comes to long-term care. They provide 24-hour supervision, 3 meals a day, assistance in ADLs, which are activities of daily living, things like showering, eating, dressing. They also will provide nursing care if your loved one needs it, and rehab services like occupational therapy, physical therapy, and speech therapy. So when it comes time to choose a nursing home or any type of facility, really, I think these steps are really great to go through. So consider what's important to you. Do you want a place that has a special unit for dementia patients? Do you want to be close to friends and to family? Ask other people in the community what places they suggest. Don't forget to ask your loved one's doctor as well. Get in touch with the nursing homes that are on your list. Ask questions including how many people live there, what is the cost, is there a waiting list? Visit and meet with the director and the nursing director. Medicare nursing home checklist has some great questions and things to look out for when you are visiting. I'm happy to print that out and mail that to anyone who's interested. Ask questions. See how long the key people have been there, such as the director, the nursing director, the head person for food, and the social worker. High staff turnover can be a bad sign. Visit again. This time, don't call ahead. Try to get there a different day and time, possibly during a meal, and that way you can see different activities and things that are happening. And make sure you fully read the contract. If you don't understand something within the contract, it might be a good idea to have a friend or a family member read the contract as well. Make sure you don't miss or misunderstand something. Okay. I see there's someone who's interested in the nursing home checklist. If you could just privately, just to all panelists, send me your address, that would be great. If not, I think I might have it. Hospice and palliative care is our next section. So start with palliative care. This is when a person is in palliative care, they receive comfort care for any of their symptoms, as well as treatments to help cure the disease. When a person's in palliative care, they have a consultation team that includes doctors, a social worker, a nutritionist. Medicare, Medicaid, and the VA and private insurance companies will help cover palliative care. You would need to talk to them about what they cover and make sure your situation specifically would be covered. Over time, doctors determine if the treatment is working for you. You could transition to hospice if you meet the criteria for hospice, or you could continue on palliative care with the primary focus being on comfort care. Hospice care, on the other hand, can be provided in any setting. Happens when a patient no longer wants treatment, or it's no longer possible to cure their illness. So it's just providing comfort care. It's usually it is for people whose doctors believe they have 6 months or less to live, but it does not mean stopping all treatment. It doesn't have to be permanent either. And the majority of the care is provided by family and friends. Paying for care. I'm going to skip this. So paying for care, this is a big thing to think about, how you're going to pay. So personal funds are one option, also known as paying out of pocket. Older adults may pay out of pocket for adult day programs, meals, or other community services. These community-based services can help them stay in their homes for longer. Usually, assisted living facilities and continuing care retirement communities are also paid for out of pocket. However, and in some states, Medicaid may help with the costs, but unfortunately not in New York State. Medicare. This is for people who are 65 or older, or people who have late stage kidney failure. If they've been on Social Security disability for more than 24 months, Medicare will help pay for some medical costs. There's different parts. So Part A, you have to pay a deductible before the coverage will start. They'll also cover nursing home stays for certain illnesses and only for a short term, like a rehab stay. It also covers hospice care in the last 6 months of life. Part B covers doctors, outpatient care, and other medical services that Part A does not cover. And it will cover some preventative services such as flu shots and diabetes vaccines. Part D covers some medication costs. And with Medicare, no in-home personal care is covered. Medicaid is the federal and state program. It's for low-income people. It covers medical care and can cover long-term care. Eligibility and services vary from state to state. In order to receive PACE, which is the Program of All-Inclusive Care for Elderly, it's a Medicare and Medicaid program. You have to be living within the service areas. So in New York, they are Buffalo, Rochester, Albany, Syracuse, and New York City. These are major city areas, but it is for people who are 55 and older, live in one of those areas, need nursing home level care, and are able to live safely in the community. The VA will also help. They may provide long-term care or at-home care. There's possibly a waiting list for VA homes, and it is available to some veterans. So check with the local VA. That's something that you think you may qualify for. Social Security disability income. So this is SSDI. They have what's called the compassionate allowance to help people with Alzheimer's disease and other dementias and serious medical conditions get disability benefits faster. They need to meet the following criteria. They're unable to work. The condition will last at least a year and expected to result in death. You may be able to get the application expedited. Long-term care insurance. So if you already have long-term care insurance, it varies depending on the type of policy that you've purchased. There are nursing home only coverage policies or policies that include facility care as well. The cost increases as you age and as your health declines. So a person who is in poor health or already receiving end-of-life services may not be able to get long-term care insurance. You should shop around and compare policies before choosing one to make sure you pick one that's going to be the best fit for you. Yes, it is very disappointing. There's someone in the chat box saying it's very disappointing when there's no money to pay for assisted living or nursing home care. Absolutely. It's a really big struggle for a lot of families. unfortunately. Reverse mortgages. So you need to be 62 years or older. And this will let the homeowner take part of what they own in their home and get cash for it. Does not need to be repaid until the home sells. There's no income or medical requirements. It's tax free. And the existing mortgage, if the home is not paid off for already, has to be paid first with the reverse mortgage funds. Life insurance. So you can get an accelerated death benefit if your policy has it. This allows you to get cash advances when you're still alive. When you do this, the amount you withdraw is taken from the amount that your beneficiaries would receive when you die. You can be eligible for accelerated death benefit if you are permanently in a nursing home, need long-term care, or are terminally ill or have a life-threatening diagnosis. You can try to sell your life insurance policy for its current value or take a life settlement. This is for people who are over the age of 70, and the income from the sale is taxed and can be used for anything. Vehicle statement lets people who are terminally ill sell their life insurance policy to the insurance company for a percentage of the death benefit. This is usually for people who are expected to live 2 years or less, as it can be very difficult to get. All right, and then the last thing I want to talk about is annuities and trusts. So a person may choose to enter a contract with an annuity company. In this case, a person would make payments to a company and the money stays with the company as it collects interest. Then the person, when they ask or when an agreed upon time between the company and the person happens, the payments begin getting made back to the person. A trust is when a person transfers their assets to another person in a legal document. That person will then become the trustee and now manages and controls the assets for the person. There are 2 types of trusts that can be used to help pay for long-term care services: charitable remainder trusts and Medicaid disability trusts. Now, if you are interested in having a trust or looking towards the future, it's important to start planning now. Medicaid or Medicare has recently changed their look back period. So it used to be that for community Medicaid, if you were having someone needed help paying for someone to come into the home to help care for your loved one, there was no look back period, or it was a very short look back period, but it is now 2.5 years. So they will look back in your finances. If you are in the Clinton County area, you can talk to the Rural Law Center. They are a wonderful resource for people who are looking to start a trust. They're not sure what the best option is for them. It's definitely something to look into. You can also check with your local Office for the Aging if you're not in the Plattsburgh area to see what other agencies are available that are reputable. And that brings me to the end of my presentation. I do want to share this book with you. So normally when I do my presentations in person, I always bring a book with me to give out. This is the book, The 36-Hour Day, that I usually give out with this presentation. And I have it in the large print version. So it's not quite as scary. It's large print, and you don't need to read it cover to cover. It has a really nice index. So if there is something you're having a question about, this is a great resource. You can look up whatever that topic is. Let's see. I'm having an issue with nutrition and meal times. Okay, go to page 113, and that's where I'm going to find it. So if that is something you are interested in, happy to either drop it off to you or mail it to you, either one. Just let me know.